Hello everyone, welcome to Digital Health News. We are here at CII Digital Health Summit 2024 and we have with us Dr Shuchin Bajaj, who is the MD of Ujala Cygnus Hospital. Thank you so much, doctor. Thank you so much for joining us and for your time. I heard your session, it was very interesting. The first question that I want to ask you is, as a doctor turned entrepreneur and now you're also looking at the way technology is improving across hospital systems, from your vantage point, how have you seen technology transform over the years?
Thank you very much. See, when I started out, technology was at a very nascent stage. Even cell phones were not very common, and you had to pay for outgoing and incoming calls. So, missed call was a structure that came out of those times that you didn't speak because it was too expensive. And at that time, one of my very close, dear friends told me that one day all technology, all communication will be free. And I literally laughed at his face because calling even from Delhi to Mumbai used to be like half a month's salary if you wanted to call immediately. So I was like, communication can never be free. And then, of course, you heard in the panel that WhatsApp came in around 2011 and 12. Before that, we couldn't even see the ECGs of patients. We had to go at 3 a.m. in the middle of the night to see a patient because his ECG was doubtful and the residents didn't know what exactly was happening. We had to go and then see, oh, the ECG is normal, don't worry, it's just acidity maybe, and then come back. So then ECGs could be transmitted easily on WhatsApp, and now even interpretations of ECGs happen. And hopefully in the future we will know the risk factors and who is at a risk to have a heart attack so that we can prevent the heart attack. So we have moved from information which was at a premium and which became commonplace to now to insight, where we are translating and interpreting that information. And hopefully in the future we will go on to foresight also, to make sure that whatever information and intelligence we have, we can use it to predict and prevent future disasters.
Absolutely. The focal point of discussion today was artificial intelligence in healthcare. How do you at Ujala Cygnus integrate artificial intelligence to improve the patient outcomes?
So we use a lot of tools. The easiest and simplest tool that we use is a WhatsApp based chatbot that uses a lot of machine learning and language programs to make interactions with the patients easier. So patients can actually just chat with us on how they usually chat on WhatsApp. So they can do appointments, they can source their reports, they can do artificial intelligence consults based on the reports that they're getting, that what is the diet they should follow, what usually the precautions they should follow, to using, as I said, ECG based machine learning, where the ECG actually interprets the ECG and the machine interprets the ECG. And in case of any doubts, then the ECG gets escalated to a cardiologist. So the cardiologist doesn't need to see each and every ECG. And if there is a doubt, then the cardiologist immediately within a minute or so has the ECG, can interpret it and say that the heart attack is happening at any kasbah or village where the machine is deployed. We also use diabetes reversal programs to reverse diabetes, and a lot of clinical decision support systems, a lot of diagnostic abilities to make sure. There is a demo going on right now inside on a radiology AI technology platform. We are very proud users of that. So we use a lot of that platform to interpret our CTs and our MRIs, because it is very difficult to find radiologists in the middle of the night. So that software interprets the ECG findings and then in case of any issues gets escalated to a radiologist. So use a lot of those machines to make sure that we can offer affordable healthcare to our communities.
Dr. Change management has been one of the biggest issues with digital transformation in healthcare. A lot of people talk about how the senior doctors are sort of not willing to change to a newer technology. What do you see? Will the next wave of healthcare revolution, healthcare transformation be led by patients who want hospitals to change and adopt technology, or there would be a change led by the healthcare practitioners adopting to digital readily?
So I'm quite tired of actually explaining this to technology people. Unfortunately, they throw the brunt of all the technological failures on the doctors, that doctors are not ready to deploy, doctors are not ready to accept our technologies. Let me tell you very frankly and freely, if you develop a technology that is of use, that can either earn you money or save you from pain or give you some comfort or give you some entertainment, people will use it, period, no doubt about it, right? Doctors are not using it because maybe they do not find any value in it right now for themselves, right? So saying that technology is not being used is the failure of technology providers, not technology consumers. Just like when you say that, oh, today's children are so smart, they can operate iPads and they can operate phones. It's not the children who are smart, it's the engineers who have made these machines so easy to use, right? At my time, as I said, just to switch on a computer, we used to key in some two-line commands on it, in basic language, that this is the command you need to follow, and then it would come up and say, okay, now we can start doing something. Now you can just do this and the computer is ready to use. So the technology has to be comfortable for the doctor. It has to provide a sense of, say, financial or technological or clinical expertise to the doctor. Doctors are the ones that have been using technology since the earliest days. When the finance people were still maintaining ledgers by hand, we as doctors were already using machines like stethoscopes, x-ray machines, ultrasound machines. So we have used them whenever we have found that it is to the benefit of us or our patients. Ultrasounds have been here, x-ray machines have been here for more than a century. Which other industry right now has used any technology for more than 100 years? None of them. So doctors are very amenable to using technology, provided the technology provider provides us that technology, right?
Absolutely.
So you have to provide us something like a stethoscope. It is not fashionable or it is not comfortable for us to carry a stethoscope all the time, right? But we do carry it. Why? Because it is important to us. So we are ready to use technology. The providers have to give it to us.
Absolutely. So, one last question from my side is, you have been a doctor and then turned entrepreneur. Which among the two roles you really, really like?
Those are two very different roles. So, see, I remember in my earlier times, one of my very good hearted advisors and friends said that now you choose one, because traveling in two boats, you will definitely sink. So, you either choose to be a doctor or give it up completely, because you have three hospitals now. So, you have to give up one of these roles. Either give your hospitals to somebody else to manage, or you give up your clinical side and just spend time in managing. I feel that's not really true in the sense of a service provider where service excellence is very important. If I stop seeing patients completely, then I move to that management role, which is like really high, 30,000 feet above, right? And you just see from the top that something is going on. And personally, I like to call it the watermelon syndrome. Because if you see a watermelon from far, it is all green, right? Everything is green on the outside. So your manager will say, everything is fine, sir. Everything is going well. But when you go inside the watermelon, everything is red. It's all blood everywhere. Patients are angry, nurses are not happy, doctors are cursing you. What is this? So you have to be in the hospital at least some of the time, then step back. So you have to be on the dance floor as well as on the balcony sometimes. So you have to perform both roles. If you're dancing all the time, then you miss the big picture. And if you're on the balcony all the time, then you really don't know exactly what is going on inside. So you have to step in between those two. I enjoy both the roles very much. But yeah, in my heart of hearts, I enjoy my clinical work a lot, because that's what I've been trained to do. I've studied more than 10 years to do that clinical work. The entrepreneurship is more instinctive. I have not had any formal education around it. The government has not spent any money on me to train me to that. So I feel that it is more of a responsibility, and I feel happier also amongst my patients more.
Absolutely. Thank you. Thank you so much, doctor.
Thank
Thank
you.
you so much.